Hello, everyone, and welcome back to another episode of Life Support. As always, we're your hosts. I'm Danielle,
I'm Dominique.
and today we are going to do a wee catch up, mainly talking about our experience on placements in our hospitals.
Yeah, so we decided that because our lives are basically placement 24/7, we'll just do a separate sort of chill episode on our experiences on placement, what we've seen, what we've been doing, how it even works. So I'm sure if anyone here is like a medical student in their earlier years or thinking about applying to medical school, you might be anxious about like life on the ward sort of thing as a student. So we'll just share our experiences, and hopefully we'll get some of our friends along as well to sort of share things that they've seen and come across.
So, as always, you can follow us on Instagram and TikTok.
Mm-hmm.
We're going to try and post a wee bit more reels, more stories, stuff like that.
Yeah.
We'll try our best.
Scout's honor.
And you can catch the episodes on YouTube, Spotify, and Apple Podcasts. But yeah, anyway, should we get into it?
Yeah. So, placements.
Yeah.
The wonderful world of placements. We'll just start with like how it works, where we've both been, and then we can go into like some Q&As and stuff like that, or like story times of what we've done.
Yeah. So basically, placements are like at Glasgow Uni. It's like basically the second half of the whole medical degree.
Mm-hmm.
Pretty much like after your third year exams, onwards to like fifth year.
Yeah.
You're just on different like placement rotations.
Yeah.
So in third year we do a junior med one, a junior surgery one, and an SSC. So we choose it ourselves.
Yeah.
So
and they're like 5 weeks blocks for us so far. So we've done 5-week block one, and that was both of us for medicine.
Yeah.
And then 5 weeks now we're currently in the middle of for junior surgery, and then we'll do a 5-week of a student selected module that we pick something out of a list, or we can self-propose, but they tend to be more clinical in nature compared to the ones that we've done in the past.
Yeah. So I guess starting from the beginning, where were you for your first block?
So in my first block I was in Ayr Hospital, and that was for medicine, as I said. It was really nice actually. Like, it's one of the further out ones. We got told our allocations, I think it was like maybe a couple of weeks before we went, right? And we had just been doing like sort of days out to placements, so like a GP visit or a hospital visit throughout our last block, like third year. And I did my GP one in Ayr. And like initially I was like, okay, it's Ayr, it's a long trek, it's just for a day though, cool. And then when it came to the allocation, I was like, right, like sounds so mean. Like, I hope I don't get it because I've just done Ayr, and I kind of want to just stay local so I can like get to grips with placement in like a familiar environment. Click, open, allocation, first one is Ayr. And I was like, oh, great. But actually I was really like pleasantly surprised. So it was a good experience. What about you?
So I like had some like circumstances, so I was like, let me stay in Glasgow.
Yeah.
Mexico was like, yeah. So my first block was in Paisley, which is not Glasgow, but it's not too far out. It's like a 20-minute drive.
Yeah.
So it wasn't too bad getting there. It was a small hospital, relatively speaking, but it was a really nice experience. Everyone was really nice, so willing to teach. So I had a great experience. Yeah. So I think basically to like sort of summarize our placement experiences, we're going to talk about it in like different categories. So we're going to do like teaching, clinical environment, and the more social aspect of it.
Yeah.
So just starting off with you and Ayr, just going through the different categories. How was the teaching there?
So for the medical block I thought the teaching was really good. We have clinical teaching fellows who are so they're above foundation year, but they're maybe not on a sort of specialist training program, so they maybe have a gap between their training, and they're more like involved with teaching students and things like that. They're still working as doctors, but they're more into teaching and things and education. And in Ayr, I think there was like 12 of them, and then there was like maybe 16 or 18 of us students, so it was almost like one-to-one. Like our supervisor was CTF, and he had like just 2 of us, so it meant you had a lot more time for the students. And then they put on a lot more teaching days as well. So our timetable will be 1 week on the wards and then 1 week teaching. And during the week of teaching, you'd have like bedside teaching where they'd go up to a patient and sort of do a history, do an exam, then go away and talk about the patient condition and things like that. So it's very like inclusive, very like, I don't know what the word is, but just very involved in your development. And that was really handy. And then just lectures, but not like a big whole lecture whole thing. It'd be like, again, like maybe 8 of us in a room or something. So again, small group teaching is really good for like confidence asking questions if you're unsure, spending time explaining more complicated, complex conditions and cases with you, and very case-based learning as well. So rather than just it being straight from a textbook and like very like, oh, this is the mechanism of this and that, it's more like, right, patient comes in with this, they have these symptoms, this is how we're going to investigate it, this is how we're going to manage it, these are our differentials, and blah, blah. And I just felt a lot more like, okay, I'm learning to be a doctor now, as opposed to more science. Yeah. What about you and Paisley?
So yeah, in terms of teaching, we had 2 CTFs.
Oh, wow.
But there was about 11 of us doing medicine at that point. But they were really involved. Mm-hmm. Like we probably had a bedside teaching every week. We had different lectures. Yeah. We had teaching from other like staff members. Like we had Jerry teaching once a week, which was really interesting. We had like some biochem and like endocrine teaching. So we get to teaching for like different specialties. Yeah. And the teaching was like, for the most part, really interesting and like well thought out. And the CTFs were like,
I love that for the most part.
For the most part, people who are there know exactly what I'm talking about. Yeah, and the CTFs, they were really involved. Like any questions, they're willing to answer. Mm-hmm. They were going over things in really like in depth a lot. Even like on the wards, there was like the consultants and like the doctors there. They were willing to teach like during ward rounds if there was something interesting. They'd like show or like they'd ask questions, being like, "Oh, so like, do you know about this? Do you know like what this test does?" That and like if I didn't, they wouldn't like.
Don't grill you.
They wouldn't grill you. They would like explain it in a way that's like, oh, okay, I get it now.
Yeah. I think that's been one of the big like eye-opening experiences, because you hear horror stories of going onto wards, shadowing consultants, and just being grilled or like torn to pieces basically, and then you're like, I don't think I want to do this anymore.
Yeah, grilled or like just completely ignored.
Yeah, either they focus all their energy and attention on you, or they don't, like you don't exist in their view. So it's one or the others. But this was quite good, like definitely way more interaction with them than I thought. A lot more engaging and open and approachable, a lot of them, most of the time anyway. There's obviously some that you're like, you hear reputations and stuff and you're just like, I want to stay out of your way. But for the most part, they've been really like nice and teaching and stuff.
So now moving on to clinical sort of environment. Mm-hmm. So we're talking about like the staff, the hospital itself, and like patient experiences.
So there's sort of variation and like what kind of patients you'd see day to day.
So how was your overall experience in those realms?
So overall, like the hospital itself wasn't a very big hospital, which I think was great for it being our first clinical placement. Like you could find your way around pretty easy. Obviously the first tour you're always gonna be like, where is everything? But after a while you're like, I know where I'm going. That was great. The staff, for the most part, again, lovely. Like, you'd walk past a corridor, even if you had the slightest look of confusion in your face, someone would be there smiling, happy to be like, oh, where are you going? Oh, I can help you there. But so that was like, oh, okay, I'm a little duckling and all these people are here to help support and nurture me to grow. So the staff were lovely. Like our CTFs were like first point of call. They were all super friendly. My tummy keeps rumbling, sorry. But they were all super friendly. And then even the consultants. There was one consultant when we started, so we got grouped together in pairs, and me and another student called, what's your names? Nigel. Shout out to Nigel. We were grouped together, and our first shift was to go to CAU, so Combined Assessment Unit. And it's sort of like a mini A&E. So like if you're well enough to walk through the doors of A&E, you sort of went in there, or you like referred from your GP. So we were in that ward, and that bit is a bit confusing. There's different sort of areas. So we were like wandering around, trying to find a way around in our first shift, like, oh, where do we go? And we stumbled across this consultant, and he was just like on a different planet kind of thing. Like, he was lovely. Well, I thought he was lovely. A lot of the other doctors were like, stay away from him. But like, I was like, he seems to chill. But he would literally just like natter away at you. He'd tell you all about the patient and the problem. He'd be like, right, go and speak to that patient and then come back and tell me all about that patient. He just felt like you would get a lot of good stories and time with him, and he's obviously seen a lot in his career. Now, if you're a busy FY1 and you've got a lot of stuff to do, I can see why they weren't the most impressed by that. But for like this bright-eyed, bushy-tailed student that's like, oh, I want to learn lots, it was nice to have him, because he made you feel part of the team as you were going around on the ward rounds, and he'd spend time explaining things to you and be like, do you know this? And I was like, no. And I was fearing, like, oh my goodness, he's going to be like, you're a terrible doctor if you don't know this, blah, blah, blah. But he'd just be like, Google. Just get my phone out and like get up. So yeah, he was lovely, but for the most part, everyone was really chill. Building wise, as I said, it was easy enough to get around. It's sort of like a loop, similar pattern around. Didn't go into theatre because we were on the medical block, so I didn't go in that area. Actually, I did go at the end, but like not officially. But and people. So most of the patients tend to be like Jerry's, you know, like, I don't know. I felt like that was a running theme. Like, every patient, even though we'd go on different wards, most of them were like, this patient is 50, 60-year-old, male, female, white, from the local area. And you're just like, okay, like, similar demographic. So not a lot of like diversity. Obviously diverse in what they had, but not a lot of like demographic diversity, which was good in a way, because maybe it was easier to sort of just get to grasp with basic concepts and things like that, and not have too much variation and like, oh, this is this skin condition on one thing, and this another thing, and this is this cultural background and that cultural background. Like, maybe that helped it stay close to textbook, but obviously that's bad, because life's not going to be just a textbook patient. So yeah, it was kind of like, oh, okay, there's not a lot of people from different backgrounds here. So that was interesting. But yeah, overall, I would say it was good. It was a good place to start my clinical experience. Yeah. What about you?
So in terms of the hospital itself, Paisley, like yours, was a pretty small hospital. There's not much there. It was actually a pretty simple hospital in terms of the layout. So like, you had like one sort of like block area that was all the medicine wards.
Right.
And you had a corridor that led you to another block that's just all the surgical wards.
Okay.
And there's some like in between, but like mostly it's just like medicine block, surgery block. I didn't have to go anywhere else for mine, so it was just there. Yeah, everyone there, all the staff, all the consultants, nurses, doctors, everyone working there, extremely nice, super willing to help, really willing to teach, and like nice to even chat to.
Yeah.
Everyone, great experience, and patients. Yeah. There wasn't. Yeah. So like, I said, start in Jerry's wards. Everyone pretty similar. Like, they were all really nice. Yeah, there wasn't much variety in terms of like what you're seeing as well.
Yeah.
So like, Jerry's, you're seeing a lot of like Parkinson's, dementia, those sort of things.
Yeah.
And then the other wards I went, you're seeing like a lot of the same, but none of the patients were like rude or anything. They were all like fine. If I wanted to come in and like chat to them, they were all really willing to chat.
Yeah.
And like, to get like examinations, they were really willing to let me do examinations on them. Overall, really positive experience.
Yeah.
Happy started there.
Yeah.
Because they gave like a good vibe for like anything else. Yeah.
Yeah, I think as part of our placements, we've got to do like cases and things like that. So you have to go and talk to the patients. And I remember in the transition week, they were like, as part of that, you need to like go and speak to the patients. So just go and speak to them. And I thought, like, surely you're not going to let a bunch of third years who have very little experience on the wards go up to random patients and just start nattering away to them. Sure enough, that's exactly what they wanted. So like, it just come to days where you just like, oh, I need to like get a case filled out. So I'm just going to wander around, and oh, this person seems quite chatty and awake and like not in so much pain. So you just, hi, can I have a chat to you? And honestly, some people in the hospital are like, you could spend hours at their bedside. They would just tell you their whole life story. And I have to sometimes remind myself that, oh, like I've got other things to do, because otherwise I would just sit there and just coffee and cake and lots of stories with the patients. So
yeah, I remember one ward I was on, one of the doctors was like filling out a form for a patient, and he's like, oh, I actually don't know what this patient has, haven't seen it. And he was like to me, instead of like cooking he was like, you know what, why don't you go talk to the patient, and come back and report to me, tell me what they have and everything.
And that'll be like one of your assessments.
Yeah, and then he's like, do the assessment and tell me what they have, because I actually don't know.
Yeah.
I was like, you're really going to let me trust me to do that?
Yeah, exactly.
Like, okay, I'll go do it.
How did you find it?
It's fine.
Yeah.
Like, everyone's really nice. Really, it's not. It's a lot more nerve wracking than it actually is, because like everyone's really chill about it.
I think in our heads, you sort of, you know, your position as well. Like I know that I'm a medical student, so I know what I don't know as well.
Yeah.
Whereas the patients don't, and they have a lot more faith and like optimism, and just, I don't know, like they just see you as more capable than you think you are. So like there'll be a lot of times you just go in and they'd even be like, oh, hi doctor, and I'd be like, no, medical student. I'm not a doctor. And they'd be like, oh, you're like training, how long's left in your training? And they're just so eager to find out more about you. And then obviously you get like, oh, well, good on you and all that. And then you're like, oh, okay, yeah, maybe I am doing something good. You know, takes away from all the stress of like exams and stuff. Yeah. But yeah, I think patients are so eager to like share their story. I think because you're sitting in bed all day as well sometimes, and it can feel like no one's there to like.
Sometimes they're on their ward for like weeks, so they get like a bit bored. So like they really appreciate someone coming in and just talking to them about anything.
And you can see how happy they are when you've just shown that bit of genuine interest. Like it literally brightens their day, and you're like, oh, I did that for someone. I'm so sad because I'm like, I'm doing that now because I have more time. I hope I don't lose that when I like start working, and I can still maintain showing that genuine.
Like, if there's any time, like try and chat to
them, like humanity.
Yeah. So just going on to our last little categories, about the social aspect of the placement itself.
Yeah.
So how was it for you?
Oh, it was amazing. Like, so for AIR, we have accommodation for a bunch of us students because we're quite a bit out of Glasgow. And the group of us that all went, we just had a ball. Like, I think every week there was some sort of activity on, like we'd go out for drinks or have a flat party because it was someone's birthday, and we had a theme night, and it was like dress up as letter beginning with A to match her name. And that was really fun. Guess my costume.
It began with D.
No, it began with A.
Began with A. Okay.
Just told him this. What would it be? What would be a low effort costume? Beginning with A. Hint, hint, medical.
What?
It's a medical costume. Beginning with A. A medical specialty that begins with A.
What? Anesthetic?
Yeah.
Okay.
I was like, the easiest costume I could get. I was like, I wear scrubs all day.
Oh, just wear scrubs.
Exactly. So I wore scrubs. Stereotypical anaesthetist costume. Not to offend any out there. Just had my wee Sudoku. My scrub mask and hat. Sudoku coffee. Well, actually, we turned up with me and our flatmate. We decided to make cocktails for every sort of flat gatherings that we did. So I had a big jug of a cocktail and a crossword in my hand.
That's good.
Yeah, it's a good costume. But yeah, social, it was really good. Like sometimes we went to the gyms together, going for runs, going shopping, cooking dinners together. It felt like you were back in halls in first year again. So that was nice. And then because it was a small hospital and there was quite a few of us together, when we like bonded doing things like that, it meant whenever you were like on the ward, you'd bump into each other, you'd be like, oh, hi. And then you'd have a little like mini debrief about what's going on in your day and then like walk around. But that was good. It's quite sad. We had our like last night out and we were like, oh, hopefully we'll keep in touch, have a like reunion and stuff.
Yeah.
Because we did have a good time. But yeah. What about you? How's Paisley? Paisley Clue?
It was quite similar in that we did get really close somehow. Like,
yeah,
we weren't in a like hall together. We weren't living like together or anything. But like, I think like there was like 11 of us, and we just like, we don't know, we just clicked pretty much. So we just all clicked, and we like all like were chatting. Like, we'd see each other like on wards, like in teaching during lunch. We'd all end up having lunch pretty much at the same time. Take like a couple hours.
Yeah. That's the thing. They're not so unless you have a teaching afterwards. They're not so strict. They're like, go for it.
Like, take however long you want. No, but it was really nice. Like, we had a night out at the end of it. Yeah, we'll still see each other, say hi, that sort of thing. But yeah, it was really nice as well.
Do you feel like this experience is sort of like the beginnings of us building our like lifelong friends in the course? You know, like
it's been really nice because like going into it, there were a couple people I knew, but like there was a lot of people. The majority of people I'd not actually like met or properly talked to before.
Right.
And it was nice making friends with them as well.
Yeah.
And like still having the people that I already knew, like friends, and then meeting new people. It was nice, and we all just like got on really well, and it made it a really enjoyable experience. I think because like you're doing it with your friends.
So you're just like expanding your social circle.
It was nice. It was nice, like having friends that are like to chat about anything.
Yeah. I think it's good because you're in that environment where a lot of people are more senior than you.
Yeah.
Basically, everyone is more senior than you. So when you can see a fellow student, you can be like, oh, okay, safe haven.
Yeah.
I did the stupidest thing today. Oh, I did something equally as stupid. Don't worry. Okay, that's great.
Yeah, but overall, positive experience all around, pretty much. And we are like halfway through our second block, so we can't like, we'll probably like
we'll sum it up.
Rate it and like sum it up
we'll
after
do another,
the end of it. Yeah.
Next episode. We could do like block by block if that's the frequency, but if we're doing more, we'll
so we'll like properly talk about it next time. But just briefly going over, we're both in the same block.
Surgical block.
Royal.
Yeah.
A lot different than it was the first time. It's a lot bigger of a hospital.
Big contrast to it, yeah. I mean, we'll go over it in more detail, but definitely different environment, different dynamic. The game's changed.
Everything I think has changed. Yeah. Every category is a lot different.
Yeah.
But we'll probably go over it next time.
Let you know how we're finding it.
Yeah.
And hopefully we'll get some friends to come along with us.
So if anyone is watching this who has something to say about placement, has any stories, or just wants to come on and have a chat about it, let us know.
Hit us up.
And we'll be sure to let you in the next one.
Exactly. Well, we hope you've enjoyed this sort of new format, new episode style. I quite like having a good debrief.
Yeah, it's nice.
Like, oh, okay. Hear other people's experience as well. Be like, refreshing. Yeah.
Yep. So I think that's a good place to wrap it up.
Yeah.
Thank you guys for watching. Be sure to follow us on Instagram, TikTok, YouTube, Spotify, and Apple Podcast. Catch the episodes.
Yeah.
So thank you, and we will see you next time. Bye.
Bye.